So one of the things that male patients present to our clinic for is a little bit of a sensitive issue known as gynecomastia. So gynecomastia is the physical enlargement of the breasts in males. And it's very, very important to always differentiate between two entities: frank or actual gynecomastia, which is the excess of the glandular tissue of the breast, and pseudogynecomastia, which is not frank gynecomastia, but actually the excess buildup of fat tissue behind the breast, thus causing a pseudo appearance of enlargement of the breast similar to gynecomastia. And it's very important to differentiate between the two and to inform the patient about the two, because the management would differ. And for example, in cases of pseudogynecomastia, there is no hormonal imbalances, there are no hormonal abnormalities that needs to be fixed. And the pure treatment, for example, in the cases of, let's say, overweight or obesity, is weight loss. That's an example for it. So in this case, you would go for lifestyle modifications, for changes, for exercise, for balanced diet, as well as a fix to the issue. However, in the cases of gynecomastia, also within this domain, we need to differentiate between multiple aspects of this condition. And this is because in gynecomastia, you have multiple reasons that could lead to this case. Mainly, they are linked with hormonal imbalances, with the ratio of testosterone to estradiol, which is estrogen, being imbalanced in favor of more estrogen, and thus the buildup of the glandular tissue of the breast, and thus giving the appearance of a pseudo-female-like breast in the males. And reasons, as I said, would differ in these hormonal imbalances. Treatments usually differ as well, as per fixing the core cause of the hormonal imbalance, and thus leading to the fixing of the treatment of the gynecomastia. Or let's say, for example, cases of pubertal or prepubertal gynecomastia. So in these cases, individuals usually between the age of 13 to 16 or 15, they would present with the appearance of gynecomastia in this case, and it usually resolves on its own in such males. However, in some of them, it might persist, and if it persists beyond the age of 17, and the gynecomastia is actually large, so it's the glandular tissue exceeds, I think, around more than 4 centimeters. And if it is, most importantly, causing an embarrassment to this patient psychosocially and in his surrounding environment, causing disruption of daily functionings, so you would go and do radical treatment for the gynecomastia, which involves surgery. It's very important to recognize that gynecomastia presents mainly bilaterally. However, it's not equivocal. So the difference in size in the excess breast tissue might differ from the left to the right, for example. Certain chromosomal diseases might cause gynecomastia as well. So that's very, very important to tackle that, like, for example, in cases of Klinefelter syndrome. Of course, when you have certain hormonal imbalances and you know the issue, tackling it from the core and possibly supplementing it with a specific treatment for the gynecomastia might be key in such cases. Some causes of gynecomastia include multiple endocrine reasons, that is being certain cases of hyperprolactinemia, for example, or the cases of androgen resistance. In addition to that, certain cases where you have chronic kidney disease or liver disease might be one of the reasons to such an issue. Sometimes you might have certain types of malignancies that present not related entirely to the breast, like for example in the cases of patients who have tender gynecomastia and they have testicular masses or any gonadal masses, you might find such cases as well. Other than surgery, gynecomastia is sometimes treated through androgens, antiestrogens, and of course aromatase inhibitors.